Well, it is really scary news. So now we jump from taxes into health care. The health policy in Kansas, no heart, no brain, no courage. But maybe it should be, oh dear Toto, why are we in Kansas? We're going to hear from Sheldon Weisgrau. He's with the Health Reform Research Project. This project is a foundation-funded initiative to provide education and technical assistance to consumers and stakeholders in the implementation of health care reform and the Affordable Care Act in Kansas. He has more than 25 years of experience in health policy and has worked effectively in the public, private, and nonprofit sectors to ensure the delivery of health care services in rural and underserved communities and to enhance the knowledge and engagement of healthcare consumers, providers, and policymakers. Sheldon earned his undergraduate degree from Cornell University and a master's degree in health policy and management from the Johns Hopkins University School of Public Health. Welcome, Sheldon.
Thank you, and good afternoon. I was feeling pretty good about not having to follow Governor Carlin and Governor Hayden. Not sure I feel so great about that now. Annie, nobody's going to be asking me to run for governor. Annie and I actually work together a lot, and we have been on panels together a lot and followed each other a lot, and we often have the debate about whose presentation is more depressing. I think she wins. Those of us that live in Kansas, and I know for all of you that are native Kansans, you get a lot of Wizard of Oz jokes. You probably get tired of them, but I've now been in Kansas for about 20 years, and this was my favorite movie as a kid, and so I am taking ownership, and I'm allowed to make some Wizard of Oz jokes. So I'm going to talk about a couple of things today, some which you may have heard of, some which you may not have heard of. First thing I'm going to talk about is the Healthcare Compact, and what I want you to remember about that for everyone in this room who is of Medicare age or close to it, that is a threat to the Medicare program. I'm going to tell you what it's about in just a second. The second thing I'm going to talk about is CanCare expansion. CanCare is the name of our Medicaid program here in Kansas. It's a state-designed program, and we have an opportunity to expand it to cover more Kansans, and our governor and our legislature have ignored that opportunity. I'm going to talk about that. And then, like Annie did, I'm going to talk about what you can do to get involved in these issues and make sure that we get some changes on these issues. Very briefly, I am supported by a group called Kansas Grantmakers in Health. We are very fortunate in this state to have philanthropies that are interested in public health and health care, and they all make it possible to do what I do today. One of the members of that group, the Kansas Health Foundation, is just down the street here in Wichita. So first, the Healthcare Compact. For those of you that don't know what this is, the United States Constitution allows states to enter into compacts. These are agreements among states who all might agree to do the same thing, and if that compact is approved by Congress, it can become law in those states. They're typically used for things like trade agreements between states and things like that. For the Healthcare Compact, and I'll show you in a minute what this is, 9 states have agreed to this, and you see those states in red on the map. Kansas is one of them. Our legislature adopted the Healthcare Compact a couple of years ago, and our governor signed it. What is the Healthcare Compact? Healthcare Compact is a very brief piece of legislation. It's 5 pages long. The first page is all the whereases. And there are things like, whereas we hate the federal government, and whereas the federal government can't do anything effectively. And what the Healthcare Compact does is really in this paragraph in Article 4, which you can read. Each member state within its state may suspend by legislation the operation of all federal laws, rules, regulations, and orders regarding health care that are inconsistent with the laws and regulations adopted by the member state. What this means is that the Kansas legislature can decide to take over any federal health care program. And in that case, what the federal government would be required to do is write a check for the money that would have been covered in that federal health care program and send it to Kansas for our legislature and our government to spend. Now, I sat in the hearings when this was being debated in Topeka, and The representative that was carrying this bill said, this doesn't affect Medicare. And you may have all heard that. This doesn't touch Medicare. Is there anything in the compact that excludes Medicare? Again, I urge you to read it. It's 5 pages. No. This is about federal health care. And if, in fact, if you go to the Healthcare Compact website, the group that's sponsoring this in all these states, it is exclusively about Medicare. The state of Kansas wants to take over the Medicare program. That's what the compact is about. Now, is there anything in the compact that requires states to use funds for health care? Because that was the other way it was sold. Legislators were told, oh, we would get this big check from the federal government, but we'd have to spend the money on health care. Is there anything in the compact that requires that? No, there isn't. Okay? You just heard Annie. You think the state of Kansas is capable of running the Medicare program? If the state of Kansas got a check from the federal government for all the money that is used to pay for Medicare benefits in this state, you think that money would be used for health care? Okay, so that's the health care compact in a nutshell. It is not something that is imminently going to happen. Congress has not voted on this yet. It's probably not even going to be brought up in Congress until there is a Congress that might pass it. And there is debate within the legal community about whether the president has to sign it. Certainly the current president would not sign something like this. But pay attention, because if this gets adopted in Congress, it's going to be back in the hands of the Kansas legislature. And if this gets adopted by Congress, the Kansas legislature is going to be able to say, yeah, we like the idea of getting that big check from the federal government. We'll take over Medicare. So just keep your eyes on this ball. Not something that's going to happen. We would have to continue to debate it, but it is on the agenda since we've passed this law. Okay, the second thing I want to talk about is CanCare expansion, which I view as the Emerald City on top of the hill. And that's all the rest of us going down the yellow brick road hoping to get there. So very briefly, what is CanCare expansion? Under federal law, under the Affordable Care Act, every state has the opportunity to expand its Medicaid program to cover more low-income people. Nearly the entire bill would be paid by the federal government. In fact, the law says that the first 3 years are paid 100% in federal dollars. Those 3 years were 2014, 2015, and 2016. So we've already forfeited that. But even in the long run, the most a state would ever pay is 10% of the bill. To put that in context, we currently have a Medicaid program in this state. The state of Kansas pays 44% of the bill. Moving forward, if we adopted the expansion, maximum of 10%. Here's a map of what's going on in the rest of the country. The states in blue are states that have adopted this expansion of their Medicaid programs. 31 states plus the District of Columbia. 19 states in orange, and Kansas, as you can see, is one of them, have not adopted this program. And in fact, unlike a lot of those other states in orange, we in Kansas have not even debated this. You may be aware that we had a number of legislators on our House Health and Human Services Committee who expressed some support either for adopting the expansion or for discussing the expansion in committee. They were removed from that committee. Another representative who chaired a committee called the Vision 2020 Committee, who was a Republican who actually held hearings on this bill a few years ago and proposed a law that he sent to the House floor, lost his chairmanship because he had the audacity to talk about this. Now that is harmful not only for the passage of this legislation, but the 3 people removed from the Health Committee happen to be the 3 people who knew most about health. A physician, a pharmacist, and a person who used to run a hospital foundation, all Republicans, all no longer serve on that health committee, which not only damages the ability to discuss this legislation and get this passed, but any other intelligent health legislation is now being talked about in front of a committee that doesn't really understand the issue. So why is this a problem? Because under the Affordable Care Act, every state was going to expand its Medicaid program. The Supreme Court said the feds can't require that. So we now have a law that provides subsidies to people to buy private health insurance if they are at least 100% of the poverty level. Those are the folks you see to my left, to your right, on the blue part of the umbrella. We have a lot of very low income people, and I'll show you in a second how low income you have to be in this state, who are covered by our Medicaid program. We have a big group of people in the middle who are in a coverage gap. They don't make enough to get a subsidy to buy private insurance. They make too much to qualify for the current Medicaid program. They are largely uninsured. So what's the result of that? This is a graph that shows the uninsurance rate in the United States and in Kansas. Kansas has historically had a lower rate of uninsurance than the rest of the country. You can see in 2014, when the ACA took effect, the insurance rate in both the U.S. and in Kansas plunged. The U.S. rate continued to go down. Kansas's has not. And that's because of the other states that have expanded their Medicaid programs. Kansas now has a higher uninsurance rate than the rest of the country as a whole. That has never happened before in the history of this state. So I show you this mostly to remind myself to talk about it, but also to give you an idea of what our current Medicaid program looks like. Don't pay attention to all the details. The purpose of this is that Medicaid is a program that it's not just a program for low-income people, okay? And I would say if you polled our legislators, 9 out of 10 of them would tell you everybody who's poor in Kansas is on this program. That's not true. You have to be both poor and a member of a particular category. And the eligibility requirements are different for every category. So you have to be low income and disabled, or low income and a parent, or low income and a child. If you are not disabled and you have no children, you are not eligible at all, regardless of your income. But the group I want to talk about, the group I want to focus on, because it's the starkest, is parents. If you're a parent, you're eligible for Medicaid if your income is 33% of the federal poverty level or less. What does that mean? That means if you're a single mom with 2 kids in the state of Kansas, you can be in the Medicaid program if you make less than $6,600 a year. That's $550 a month. Let me make that even more clear. A single mom with 2 kids who works a minimum wage job half-time makes too much money to be eligible for our health care program for low-income people. Furthermore, the way we have set up this program with such low income requirements is that it's a disincentive for these folks to actually work. If this single mom gets a job offer, she then has to make a choice. Does she lose her health insurance or should she take the job? Because the type of jobs that we're talking about at this low end of the income scale are jobs that don't typically offer insurance. So under the law, we have the opportunity to expand this to 138% of the poverty level, which for that single mom I just talked about is nearly $28,000 a year. Now all of a sudden, she can take that minimum wage job and keep her health insurance. So who are we talking about here? There are 150,000 people in Kansas who would qualify for this program and are expected to enroll. It's actually more people that would qualify, but everybody who's eligible never enrolls in a program. 150,000 Kansans. I've been around the state talking about this. One of the first comments I always get is, oh, sure, but it's the undocumented immigrants who would get all this eligibility. You can't be an undocumented immigrant and be in Medicaid. You have to be a citizen or a legal resident. And even if you're a legal resident, you have to have been here for at least 5 years. Not easy to qualify. We've heard the governor, we've heard many of our legislators say these folks should just go out and get a job. The fact is, more than 2/3 are working. Many of them are working in multiple jobs, as we all know. If we know people who have low incomes, many of them are working in multiple jobs. They're working in jobs that either don't offer insurance, or if they do, it's still not affordable to them. And finally, I found this statistic around Veterans Day when I was giving a talk about this. Everybody who gets out of the military doesn't automatically qualify for care from the VA. We have about 7,500 military veterans and their spouses who are in this coverage gap. We have an opportunity to cover them at almost no cost to the state, and we have turned it down. Now, let me talk real briefly about the benefits, and then we'll get to some questions. So what are we talking about? We already have a program, as I said, it's called CanCare. It varies from the federal requirements for Medicaid because we wanted to design our own program here in Kansas. We can do that with this expansion too. We can have a Kansas-specific plan. This plan is budget neutral. We have 32 states that have done this. Every one of those states is seeing positive budget impacts. How does that happen? That happens because all of these states, including Kansas, are paying for various sorts of health care services for uninsured people in all kinds of parts of our budget. We give grants to health departments to take care of uninsured people. We are paying for mental health services out of different parts of the budget. If these folks are covered by Medicaid, all of a sudden the federal government is stepping in and paying those bills for us. The Hospital Association introduced legislation last year that was budget neutral, would not cost the state a dime. Legislature did not even discuss it. It would be an economic stimulus. We're talking about billions of federal dollars flowing into this state to pay for health care services. We're going to be covering a lot of new people. We're going to be paying for people who now go to the emergency room and get services but can't pay. And we're also going to be bringing new people into the system. You spend money on services, that money circulates throughout the economy. It would create jobs. The estimates are that we're looking at 3,500 to 4,000 new jobs, both in the healthcare sector and in sectors that support the healthcare system. I heard a speaker a few weeks ago said, you know, nurses like pizza. You hire more nurses, you sell more pizza. We were talking earlier, Governor Hayden talked about or Governor Carlin, someone talked about our rural hospitals. 1/3 of the rural hospitals in this state, more than 30 hospitals, are considered financially vulnerable. They are on the financial edge. They are largely being supported by local taxes that have been going up for years. One of the big reasons we have to support our rural hospitals with local taxes is because they're all taking care of uninsured people who can't pay, but are entitled to care once they step into an emergency room. We lost the hospital in Independence about a year ago. Since the hospital in Independence closed, every single physician in that community has left. There's not a doctor left in Independence. We can look around the country. If you go back 30 years, I've spent most of my career working in rural health. We sort of experienced a big first wave of hospital closures in the 80s and 90s. There's been multiple case studies done of what happens to a community when the hospital closes. Now, there are some great examples of communities that came together and figured out something else to do, but usually what happens is the hospital closes, you lose a lot of jobs because hospitals are the first or second biggest employer in most rural communities. Second thing that happens is all the doctors leave town because doctors don't want to practice someplace where there's not a hospital. The nursing home closes, the town dies. It's happened time and time again. Financial security for families is important. We have to remember that health insurance is a financial product. It is not particularly designed to make you healthier, although that is actually a side effect of what it does. It is designed to offer financial protection to people that run up medical bills. The states that have expanded this program are finding that the number of people that file for bankruptcy because of medical debt goes through the floor because people are not going bankrupt anymore because of medical debt. And we also know a lot of research coming out that low-income families, one of the reasons they are not as healthy as the rest of us is because of the stress of being poor. And this will relieve some of that stress. And finally, as I just said, we know that health insurance makes people healthier. We want healthy Kansans. We want a healthy workforce. We need to make sure people are covered. Since 2014, the state of Kansas has forfeited more than $1 billion in federal money that would have come in to help cover people with health insurance. We have not turned down federal money attached to anything else. If the feds came to us and said, here's $1 billion to fix your roads, you think we would turn that down? Or they said, here's $1 billion to provide preschool to kids. You think we would turn that down? Yeah, maybe. It's health care. It's part of the Affordable Care Act, so we don't want any part of it. This goes up at the rate of about $1.5 million a day. I'll let you read that yourself. You all remember from The Wizard of Oz when Dorothy met the Scarecrow and she said, "How can you talk if you haven't a brain?" And his response was, "Oh, some people without brains do an awful lot of talking." So what are we doing? So what are we doing about this? The Hospital Association has really jumped on the train and has been advocating for this. There's a new group called the Alliance for a Healthy Kansas that has just kicked off actually last week. We have more than 100 members, healthcare providers, businesses, members of the faith community, individuals that are going to make this a grassroots effort to make sure we talk about this in communities because they're refusing to talk about it in Topeka. So we're going to bring it home. We're going to talk about it in Kansas communities. We're going to make sure that candidates for office are asked about this issue, and we're going to make sure they have to address it head on in Kansas. So if you go to expandcancare.com, I urge you to sign up for the Alliance at Expand Can't Care. If you can follow it on Twitter for those of you that are in social media. And I'm going to challenge all of you and all of your communities to join the Alliance, to contact the Alliance, and get us out to your communities talking about this issue. We need to start a community dialogue. We need to contact legislators. And for those of you who need to know how to contact your legislators, because you'd be surprised how many people don't even know who their legislators are, there's ways to find that out. All right? This is going to take courage. This is going to take courage by our Kansas legislators to say, you know what? Maybe we don't like President Obama and maybe we don't like Obamacare, but this is still a good deal for us. We need legislators and citizens with the courage to step forward and do that. And so I'm asking you a call to action to get involved in this issue. This is not probably an issue that's going to make people vote for or against their candidate, like the issues that Annie was talking about, but it certainly should be something that's on your agenda as you talk to legislators, as you talk to candidates, to make sure that they are keeping the best interest of Kansas at heart. Thank you.
Was the Health Care Compact written by ALEC, the American Legislative Exchange Council? Is the bill identical?
It's a great question. So the Health Care Compact is actually not written by ALEC. It has been adopted by ALEC, but it was written by another group that focused only on the Health Care Compact. It is identical in every state, but that's actually the nature of compacts. When states adopt compacts, they have to be identical in every state. So it's not something that was invented by ALEC, but they certainly have jumped on the bandwagon.
Do you consider CanCare better than getting on the federal program?
Okay, so CanCare, this is a question that's an interesting question. CanCare is partly a federal program and partly a state program. It's not like Medicare, which is run by the federal government. You can be a Medicare beneficiary and also be on CanCare if your income is low enough, but there's not a federal program that's an alternative to it. So it's CanCare or bust.
Virgil Peck, state representative, says that the Independence Hospital closed due to expansion of hospitals in Joplin, Missouri. Can you comment on this?
There are a lot of reasons that the hospital in Independence closed. There's a lot of reasons our rural hospitals are in trouble. CanCare expansion may not have saved the hospital in Independence forever. But CanCare expansion would have brought $1.7 million a year of additional revenue into the small hospital in Independence. That would have made a difference. It is something that is necessary but not sufficient to save our rural hospitals. There are other things we have to do. But if we're not going to do this, we are going to see a lot of rural hospitals close. And my fear is that the legislature is not going to pay attention to this issue until we see rural hospitals going down like dominoes. And we cannot afford to let that happen.
Current legislators say that any state that has expanded Medicare has lost money. How do we counteract that?
That is part of the funny math that Annie was talking about that doesn't add up. If states that are, first of all, no state that has expanded its Medicaid program has paid a nickel for it yet because the federal government's paying all the costs. Now, as you look out into the future, states are going to have to start picking up some of the tab. But every state that has expanded has seen sufficient savings in other parts of their budget and sufficient stimulus created through the new revenue coming in to at least cover the cost of expansion for the foreseeable future. So when any legislator tells you that states are losing money on this and that this has been a fiscal disaster, which is what a press release for the governor's office said last week, I don't know where they're getting that information, but it just isn't true. And one of the things we will be doing with the Alliance is making information available that will show you the positive impacts this is having in other states.
Why don't the 150,000 Kansans left out of insurance rise up? Don't they know about what the state is doing?
Yeah, I don't know that I'm qualified to answer that question. We heard a little bit earlier about why people do or don't get involved in politics. Low-income people are less likely to be involved in politics. Whether they know about this, I don't know. But I can tell you an anecdote of something that I hear a lot. So I also work a lot with people who are navigators, people whose job is to help folks sign up for health insurance in our new marketplace. And every one of those navigators works with people where they go through the process and they find out that they fall into this coverage gap. And a very common response is, yeah, well, I knew there was nothing here for me anyway. We have a lot of people that are just kind of resigned to the idea that government's not there to help them. We have an opportunity to do it, though, and so we really need to get people in communities, whether it's the folks that are directly impacted or not, because all of us live here. All of us are impacted in some way. When somebody goes to a hospital and can't pay their bill, that's not free. Who pays for that? Everybody else pays for that. We all pay higher prices in health care and health insurance because of all the uninsured people we still have in this state.
Thank you, Sheldon. Let's give him a big hand.